My main project for community nutrition was at WIC, and it was regarding nutrition after miscarriage. This was because a lot of the residents there and staff at WIC were inquiring about this, as they did not have a handout yet and just wanted more basic info. So I will show you the PowerPoint I went through with them and then my handout that I provided. So the overview was just describing what a miscarriage was, the nutrients that were depleted, foods to eat and avoid, and then we went through a quick Q&A and reviewed the handout. So a miscarriage is a loss of pregnancy, and the term is generally used when the loss occurs before 20 weeks of gestation. Other terms that are used for such losses include spontaneous abortion and early pregnancy failure. About 15 to 20% of known pregnancies end in a miscarriage, and most miscarriages happen before the pregnancy is 12 weeks along. In the first several weeks of pregnancy, a miscarriage sometimes happens because a fertilized egg did not properly form a fetus. In many cases, the activity of the fetal heart stopped days or weeks before the symptoms of a miscarriage began. Common signs include bleeding, although not all pregnancies with bleeding end in a miscarriage. So we then went through the depleted nutrients, and the slides all kind of outline which ones were the most crucial, and then we went into the food sources for those. So for instance, iron and vitamin C were discussed, as blood loss is inevitable and iron is crucial to that recovery. Vitamin C aids in iron absorption, and then magnesium is important for the mental health of the woman, as depression and anxiety are very common during this time when going through a miscarriage. So other nutrients were vitamin D and calcium, and a study by Mumford et al. Showed that the women who had sufficient vitamin D levels or concentrations of 30 nanograms per milliliter or more were 10% more likely to become pregnant and 15% more likely to have a live birth than those with lower levels of vitamin D. Again, in the study, among the women who got pregnant, every 10 nanograms per milliliter increase in vitamin D before conception was associated with a 12% lower risk of miscarriage. And the researchers reported by the 8th week of pregnancy, vitamin D levels were no longer linked to the loss. Other nutrients are folate and B12, and folate is crucial following the weeks of a miscarriage, just because it prevents any future neural tube defects, helps the mother heal after blood loss and the trauma from a miscarriage, and then prepare her body for any future pregnancies. Another study by Dwayne Alexander, director of NICHD, said that the results of their study reinforced the importance of folate for women in their childbearing years, because not only does folic acid during conception prevent the devastating form of birth defects known as neural tube defects, but it also appears to lower the risk of an early miscarriage. And then the essential fatty acids are required for that embryo brain development during the first trimester, as it utilizes DHA and EPA fats in large quantities, and also helps prevent that baby or mama brain some women experience, which can very much be likely due to a essential fatty acid deficiency with symptoms of forgetfulness or lack of concentration. Then we discussed protein and calories, because women would be in a very catabolic state during this time, and they need ample amount of calories to help rebuild. We went into the micronutrient RDAs, as women will need more during this time. Here are the food sources of those depleted nutrients, including folate, vitamin D and calcium, B12, iron, vitamin C, and then magnesium and essential fatty acids. Then, most importantly, we discussed that these women need to have resources and need to feel like we are supporting them here at WIC. And so it's okay to have feel-good foods, and they don't need to avoid food all entirely. And the handout that I provided outlines these nutrients as well.